Hey, everybody, it's Dr. Sally here, and this is Headspace for the Workplace. It's a podcast on how to cultivate vibrant and psychologically healthy and safe workplaces. And today we're going to be talking about what workplaces can do to support the culture of resilience and mental health from an evidence-based perspective. And my guest is someone who I've had some contact with through our Construction Working Minds Summit, Dr. Joel Bennett. Welcome to the show.
Hello.
Hello. And what are the two things that our listeners are going to take away from after the end of the podcast?
Well, I think knowing the leading indicators for mental health and substance misuse risk in their workplace, and really, if these are leaders, it's time to take responsibility for addressing these work environment factors.
You're speaking my language. I love it. I love it. So tell us a little bit more about you. What do you do every day?
I do training of trainers, consulting, writing, and the area that relates to this. I train people to deliver programs that address the risk factors that we just talked about and do research on that. I also have a whole hobby on presence work. I have a whole Quest for Presence set of workshops that are about helping people to develop a healthy relationship to time. And so I have my third book coming out. And those two are related because one of the things I'll just quickly say is that what I found is that many people are not present, and including leaders who have much to juggle and many responsibilities that lead them to burnout, to ignoring their own health concerns. And so we started to get into the presence part as a complement to the work environment part as well.
Oh, someday we'll have to unpack that as well. I love it. The presence piece is something that I think United States culture doesn't really value. We value the conspiracy of busyness and to our own detriment and very high levels of stress. All right. Well, what is something curious about you that when people learn it about you, they're like, whoa, didn't see that coming?
Well, yesterday was my 2-year-old grandson's birthday, and the 9-year-old planted a dinosaur tattoo on my neck, which you can see here. And
yes.
Now people have seen that and say, well, now Joel has some street cred. So yeah, the dinosaur, I think it's a triceratops on my neck there. So anyway,
there you go.
I'm thinking of making it permanent.
I think that's a good look. That's excellent. Something that will be a conversation starter wherever you go. But in all seriousness, why do you care about this issue? What drew you to this career in kind of workplace well-being and really up in the game with the level of research that you've dedicated yourself to?
It's a long story. I mean, how is there one factor? There's not one factor. You know, I grew up in a home where there was alcohol. My parents divorced when I was 12, but it could have happened when I was 3. My father worked in the restaurant industry. There was a lot of alcohol and coming home with alcoholic rage. And, you know, it's pretty scary, adverse childhood experience. And also my mother succumbed to depression. And obesity. So I learned early on that there were some issues here, and I could never ever separate health and wellness from alcohol and drugs and from mental health. So one of the leading things for me is this holistic view of people, and getting very upset that the culture, the medical system has divided it up. Oh, you're doing wellness? Well, you're over here. You're doing therapy? You're over here. You're doing prevention? You're over here. Rather than we carve everything up. So what's really been guiding me is this whole person, transpersonal body, mind, spirit, and getting that message out to help employees, because the workaholic environment, like you said, is probably the number one addiction in our culture, which because of people, of course, they're going to burn out. Of course, they're going to go to alcohol. Of course, they're going to, there's a common unifying message here. And until we address it all in one fell swoop, we're going to continue to pick at it, piecemeal approaches, and it isn't working.
Yes. And you don't see this in other countries, that people take Australia, they take like 6 weeks of vacation, don't even blink an eye. People have very extended family leave when there's a new child. They give, all kinds of grace around life transitions for people to really be present in those things. And they work a reasonable number of hours. And that's just not acceptable in our United States culture. We think that we're so, I don't know, I think it's connected to our sense of importance that we must work harder because we are what we do. So this is such a huge paradigm shift for us to consider, and one that I think we're coming to some pretty significant health crises in our country. Either we're going to face this, or we're going to have exponentially more deaths.
Well, the work that you've been doing, Sally, with suicide prevention in the construction industry is central. I mean, that is part of it, right? So it should be commended, because here you're devoting energy to at least one very important part of the population that's suffering.
Yeah. Well, I want to also draw out, thank you. I want to draw out the fact too, that you are a practitioner and a researcher, because most people are either one or the other, and there the two shall meet. And that is another huge problem that we have, is that a lot of the efforts out there are not evidence-based, and a lot of the good research that's happening never gets to be practically implemented. And so how did you come to that conclusion, that that was another thing that you were going to be committed to?
Well, being trained in a doctoral program by there's a certain area called applied social psychology, and getting trained in learning really important scientifically based processes that govern human behavior. Right? Like implicit bias, like prejudice, like stereotyping, like in-group, out-group, like neutralization of deviance. I know that's a fancy term, but leadership. You start to realize that these are not just concepts. They really impact people's perceptions and their well-being. So early on, it kind of got drilled into me, including women's studies, that something needs to happen to apply this knowledge to the people who really need it. And fortunately, learning how to do research, and then getting a job as a research scientist and teaching these as a college professor, kind of I honed and honed and honed to the point where, okay, now I can take all these tools and create a training program and a consultancy model to help workplaces, human resources, employee assistance providers, leaders, and supervisors to start applying this knowledge to help them in their day-to-day work, where they're faced with the workaholic norms and they don't have time, and they're worried about their children at home and their aging parents, or whatever's going on. So the mission here is really one of service.
Thank you. Well said. All right, let's dive into that first tip, know the leading indicators for mental health and substance misuse risk. I think this idea of leading indicators is something that a lot of industries gravitate to. They want to know what to look for as they're heading into the future. What do you mean by this?
Well, it's rich, because I'll give you the quick synopsis of the broad view and then hone in. We cannot look at leading indicators except from a multi-level perspective, which means there are leading indicators at the personal, individual level. There are leading indicators at the work group, crew, team, department level. And then there are leading indicators at the organizational level. So we have focused, because no one else does, on the group. And not only that, because the early research, and I have to acknowledge the work out of Cornell's Institute of Labor Relations that happened in the 70s, 80s, and 90s. People who preceded me, Dr. Paul Roman, William Sonnenstall, Harrison Trice, working with unions, and with groups, construction trades, right? They found that one of the most important risk factors is a culture or climate around alcohol. That is permissive drinking norms, social norms that support unwinding from work with coworkers, use of alcohol during lunch and sales. I mean, a whole variety of different occupations. That is a major leading indicator for a whole variety of problems, not just substance use, because often when you have those permissive drinking norms, somebody who's at very high risk gets to hide. They get to hide, or if they're a great performer, the leadership will say, I know, it's okay. He's doing a great job for us. We'll just put up with it. So that's that tolerance piece.
We call that the quarterback effect.
Yeah.
Like, we're just going to let his, sexual aggressiveness slide because he's our quarterback. We're just going to let this unacceptable behavior slide because that's the quarterback. We need the quarterback. Yeah. That mentality that we can't survive. Well, you're not doing your organization a favor or that person a favor by letting these kinds of behaviors slide.
Oh, not only that, it erodes psychological safety because no one's willing to speak up. It erodes morale. Okay. And it erodes the sense of authenticity and integrity. But that happens in very subtle ways. It's often very implicit. So that's one of the leading indicators. And that could happen like every Friday, we're all going to go out for whatever. It can be very subtle too, because people go, oh, we're just unwinding. It's not a problem, but it's a slippery slope, right?
Well, I don't know any other again, construction is where I spend most of my time, and I'll often make the joke, funny, not funny. And for those of you who can't see the video, I say, construction thinks this is normal drinking and my hand's up really high. And I said, the rest of the world thinks this is normal drinking and my hand is really low. And I get a big laugh. And I say, funny, not funny, because you have a lot of people here with substance use issues and you endorse it. You create opportunities for it. I don't know of any other industry other than the tech industry, which also has a lot of substance use issues, where there's a kegulator running, that you can access anytime. And a lot of people start to socialize about 3 o'clock in the afternoon, free flowing beer. And I was like, that became a normal thing. And it's everywhere.
Two modifying factors there. One is location. So, this is normal high. Well, let's talk about the state of Wisconsin. Okay. Right. I mean, it varies. And also the other thing is food and hospitality. Food service and hospitality has also very high risk, especially among younger male. So we're on the same page, and you can't address that with just an app, right? With referring people just to the EAP. You have to do something about the climate. So that's a leading risk indicator, but there's also a leading protective factor. And this is important. You cannot address the risk factor at the group level without also building the strength protective factor. And that is given different names, but it's organizational wellness climate, psychological safety, team cohesion, group spirit, positive, right? We belong together. We care about each other. We rely on each other. Our workplace cares about us as well, right? We have access to health and wellness. We don't throw people under the bus, It's that kind of honest, honorable climate. If you have that and you have the drinking climate, it'll lessen the risk, but you really need both. You need low drinking climate and high protective wellness. And there are many things that do both. So it's a positive psychology approach.
Yep.
We're not just talking about, by the way, because we're talking about construction, safety. These two factors, when combined, add more to the risk of accidents or covering up workarounds, safety workarounds, probably than anything else. Because, hey, I got your back, buddy, right? Drinking. And who cares? Nobody gives a shit. So I'm sorry I cursed there, but that's the language they would use, right? Let's just do whatever we're going to do anyway, because nobody really cares. So what you have is a recipe. These two leading mental health and substance misuse risk factors are also safety related.
That makes a lot of sense. Excellent. Thank you. All right, let's unpack the second tip. It's time to take responsibility for these environment work factors.
Well, we'll be here for a long time. I'll try and give it very concise. There is a problem in human resource benefits design and the way the vendors work with health insurance brokers in the United States to get programs in front of employees. And it's called the check the box human resource benefits firewall. We've got the program. It's here. You can use it. Check the box. We're good. We got it. One and done. That mentality takes all responsibility off leadership. And they go, well, HR's got it covered. Talk to my HR. They'll take care of you, right? Well, the HR is beholden to the brokers. And I won't even go into whether or not there's a lot of integrity there. And so and it's not their fault. They're encumbered just as everyone else. They don't know what kind of choices to make. So the key here is to take responsibility for these work environment factors. You have to sit down and talk to employees with human resources in the room and make it safe to talk about these things. As a leader who walks the talk, who's willing to share their own story, who's willing to recognize that they themselves have mental health risks, who expresses some degree of vulnerability. You can't take responsibility without being present, right, to what's going on in your own life instead of just doing on the workaholic treadmill. So I'll stop there, and hopefully that conveys that point as concisely as possible.
Yeah, no, I see this all the time. I call it the broken person premise, that like, oh, well, we'll get those so-called broken people, those troubled people into counselors and we'll be good. And I say, well, what do you think is going on? They're like, oh, stigma around mental health. I'm like, you know what? When I listen to the workforce, what I hear, too many hours, too far away from my family, high stakes kinds of work where I don't feel like I have the tools I need to do the job safely or well. Like these are work design kinds of issues, not troubled worker issues. I mean, they're causing people to be troubled, but it's very much an environmental root cause and driver. I think there's a place in the middle where we have both but the overwhelming tip is, those poor troubled people, they just need a good counselor. And I'm like, you can send them to counseling all dang day. If you're still treating people this way, if there's still bullying and discrimination and hazing and harassment and the laundry list of psychosocial hazards that we know about, that counseling is never going to do the trick. So I love this. It is time to take responsibility. And I'm not sure what lever we're going to need to pull here to get workplaces to really wake up to this. Do you have a sense of what that needs to be?
Well, first, I just want to echo what you said about the broken person syndrome, I guess you might call it. Everyone talks about implicit bias and diversity, equity, inclusion, and belonging. And there's been so much time and energy and focus on that. It's the same thing you're talking about here. It's a form of stereotyping and stigmatization, because what you're saying is it's their fault.
Yep.
These work environment factors have nothing to do with it. What's wrong with them?
Right.
And maybe I don't want to say unlike DEI, because there's mental health problems there. This is very damaging to someone who has mental health risk to treat them that way. You're pushing, no wonder there's suicidal ideation. So you're talking about something that's fundamental to being able to shift the paradigm. You have to first confront your own implicit bias about mental health as a leader. And if you haven't done that, then there's no hope, because you're walking the talk is the number one. I don't want to put all the burden on leadership, but it is so important to come clean.
Right. And that's
okay to not be okay. It's okay to not be okay.
We have wonderful benefits for the people, for the others, instead of the we, like we're all in this together. Me too. I've also had my struggles. Here's how I've gotten through. Yeah. When I have a leader that's willing to say that, a lot of things start to change in the culture pretty quickly. Well, Joel, I'm going to go back and do a quick recap, and then I got to come back to you for final thoughts. So we're here talking with Dr. Joel Bennett about the importance of culture and environmental factors when it comes to worker well-being. And you talked about your own story a little bit about the family environment and kind of what that kind of brought to life for you, and that what it's resulted in is more of a holistic approach, that we're not just chopping up individual for focus and organizational, but that it's all together. You also emphasize the importance of research and research to practice, practice back to research. This is a feedback loop that's going to make all boats rise when we're really investigating what's working, what's not, what do we need to do more of, less of, keep the same or stop. Your focus really is on like getting in front of this. And if we're getting in front of it, we're going to look at leading indicators at the organizational level, and we're going to look at root causes from the work environment. And so that is where I think we need to go next in our workplace mental health effort as the work continues to evolve. Joel, what is the final call to action or takeaway that you want to make sure that they walk away with?
Well, we've been doing our team awareness, team resilience, team readiness programs for 20 years. These are evidence-based programs that bring employees together in a psychologically safe environment. And I am tooting my own horn here because these work.
Yep.
And because we train close to
Toot away.
500 people who are trainers who are out there, and it works. We see increased EAP utilization. We see increased supervisor responsiveness to troubled workers. We see reduced stigma. We see reduced problem drinking, coming to work with a hangover. How would you like that to come down? So I can't, say that there are other things out there that do the same thing. So I am tooting my own horn because people ignore the power of social relations at work, peer-to-peer mental health support, giving everybody tools so they can nudge their coworker. Because many times the supervisors don't know. They don't know that there's an employee who's struggling with a divorce, or struggling with a drinking problem, or struggling with aging parents who themselves are misusing prescription drugs, or a teenager. But a coworker often does. We have to give everybody these tools. And that's what our team awareness, team resilience, we work with the National Guard. We work with TGI Fridays. We've worked with a variety of other organizations. Small business, also very important. This is not just about corporate America. These are about those small, local construction employers, you see? So it's really important that everybody comes together. This is an all hands on deck team approach. That's my takeaway.
Excellent. Love it. Yeah. Not HR only. Everybody has a role to play. Joel, if people want to get connected with you, what's the best way for them to find you?
Well, there's, again, two sides. Our company, Organizational Wellness and Learning Systems, OWLS. We give a hoot. www.organizationalwellness.com. And then on our personal presence side, we have presencequest.life, quest for presence quest.life. But so, yeah, it depends on where you want to go, because we recognize you got to do both. It's got to be both personal and professional to make it work. So
thank you. And we'll put all of those things in the show notes so people who are driving and couldn't write all that down can find you more easily. Thank you. Thank you again for your passion for this, your commitment, and really up in the game with all the things that you're doing to make this as impactful as possible. Thanks to
you too. You're up in the game too.
Thank you. And thank you to the team behind this podcast effort, Dave and Brooke and Mitchell and Chase and Elias and so many folks just trying to get this into the ears of as many people to really start changing workplace mental health every single day. Thank you to the listeners who leaned into this, and to all of you trying to make a difference every day in your workplaces. In closing, working minds work well together. There are lots of things we can learn from each other to improve the well-being at our workplaces. Until we meet again, take care.